Karen, I'll bring you back into the discussion. Do you have any research or evidence of programs that food skills has fostered positive change in people's lives, especially those maybe in more marginalized populations or living in poverty?
So certainly there's a lot of research that is out there that shows positive effects of food skills program, positive in terms of improving nutritional health, in terms of mental health as well. And, really a lot of these programs have been around for many years. And so a lot of good qualitative research and also some quantitative research. So for example, one program that recently released a report, the program being called Making Something Out of Nothing, is based in Ontario and was funded by Public Health Ontario. And it was a locally driven collaborative project that focused on building food literacy and food skills among youth, young pregnant women, and young parents who had at least one of those risk factors or social determinant of health that was impacting on them. And so basically what the program helped to explore were the meanings of food literacy, as well as identifying the barriers and facilitators to developing food skills. And the report, which is on the resources list there that you can access, was based on 85 interviews that they did with people at the different sites of the program. And it was shown that food skills, the meanings and practices among the people encompass not just the technical ability of developing food skills, like the chopping, the slicing, but also increasing their knowledge about preparing food, and also those mental health components, such as building confidence, social connectedness, so meeting other people and establishing relationships. And a very important mental health outcome that I think is important anyway is resilience, or improving this ability to properly adapt to stress and adversity, because we all face challenges in life. And so, of course, being mentally healthy helps us to deal with those challenges. And that's an outcome of, a really important outcome of these types of programs.
That's great. So if we had a participant on our webinar today that was thinking about launching a food skills program that focuses on improving mental health or food literacy program, Kristen, what do you think would be a key ingredient, if you will, in that program that can make it a success?
So Karen talked earlier about some of the complications of living in poverty and possibly living with a mental health diagnosis or mental health crises. And I think it's really important to bear in mind that the barriers to accessing our programs or anything is so much more complicated, especially if you're coming from a racialized community, if you're coming from the queer, gay, lesbian, trans communities, if you're homeless. So I think the best thing we could do, our best practice, is to try to reduce those barriers and to try to be as inclusive as possible. It's really important. We'll never know the complexities of the people's lives, the people that come in and sit down to table with us, but we can assume that they are complex, and we can assume that they have a lot of struggles, a lot more complicated struggles perhaps than we can imagine. So to do that in a concrete way, I mean, it's all well and good to say that, but to make that happen, I think it takes some time to really kind of imagine the space that you want to have. And we're all limited in our venue, so we have our limited resources. How can we make this space inviting and welcoming to anyone who might be able to come into the space? And so making room for everyone at the table is not just a cute slogan. It actually literally means making space. And so, sometimes we have not enough room at the table, literally. So many people will come to a drop-in meal, but we make the space. And so accommodations include things like some people are not able to stand while they work. So a traditional industrial kitchen setting is not going to work for them. Having alternative workstations where people can sit. Some people will have walkers or scooters or devices like that. And not only does that impact their transportation to and from your program, which you have to be mindful of. They can be dropped off, hours early and have to sit there waiting for a wheel-trans pickup if they even get that. So being mindful of the barriers that other people are experiencing to get to your program is vital. So pairing people up, knowing that some people can't read and they might not tell you that languages are going to be different. In my drop-in group, there are several women who are non-hearing and non-speaking, and so we're working together, and so it's wonderful. There's like a variety of languages, including American Sign Language and my terrible miming skills, and so we're making it work, so you have to be flexible. If you're going to facilitate a program like that, just allowing for time for things to go wrong and for communication to happen the way that it needs to happen with the group that appears that time. So, yeah, preparing for anything, really.
Right. Good. Karen, I imagine it's different working more as a dietitian on a one-on-one basis with a client or a program participant than in a group setting. Can you maybe talk about some best practices or markers of success that dietitians might want to use in working with or counseling individual patients?
Finding out what their unique circumstances are. So everybody's different. They come with a different context and background. And so the dietitian would really need to get at all those different factors, those structural barriers that impact on their mental and nutritional health. And earlier on the slides that I outlined, all those different techniques like trauma-informed care, harm reduction, also plays out in the one-on-one situation. So acknowledging that, say, for example, a person could have this history of trauma and how that impacts on eating and, in particular, emotional eating. And also acknowledging that as a dietitian, as part of the best practices, is linking in with other resources. So other agencies, other health professionals, such as a psychotherapist, that really, in order to address the person's needs, is not just their nutrition, but also looking at what's going on for them psychologically. And then also looking at what's going on for them socially. And so referring out to programs such as Boost and other food skills development programs that helps them develop that part of their dimension of wellness as well.
That's great. I'm just going to bring up another one of the programs that is offered at some of our community food centers, and it's called Shovel and Spoon. It brings participating community organizations or mental health organizations in the cities that we're working in. And it brings groups, and it's a joint effort between community food centers and these community organizations, where we teach food skills around food preparation, nutrition knowledge, food purchasing habit influence, gardening skills. And it's a bit of a different model where people are brought to us by an organization. They don't self-select to come to the program like they would in Boost. And it's just a different model that's out there, and you can find some more information about that on the Community Food Centre Canada website. Before we move on, we've talked a little bit about best practices and markers of success. One of the challenges in offering food programs where you're trying to link healthy food behaviors and healthy diet with mental health improvements and changes in well-being is, how do you measure that change? And that can certainly be a challenge at the individual level and the group level. So one of the things that we try to do at community food centers is to make sure that we're linking our program outcomes with our objectives. As I mentioned, not all of our programs have mental health impact or social health impact as a primary objective. So you also have to be mindful of keeping room to collect unexpected outcomes. Just because we don't have that as a primary driver in our programs doesn't mean that people may not want to share that information and report it to us. So if you leave some room and ask people what the best value of the program is or what changes they've seen in themselves, it can help capture those things. As far as indicators of changes in mental health, certainly the Canadian Community Health Survey is a great resource. There's pages and pages of questions around mental health involving anything from how we deal with stress to our level of happiness, inclusiveness, sleep patterns, social supports, feelings of hopelessness, or periods of sadness. And often these responses are time-framed in statements of how often are you dealing with these programs. And if you had a program like Kristen's, like Boost, where you have kind of a regular attendance, you have a start date and an end date, and a length of time and a number of contact hours where you expect to see changes in people's mental health or their general well-being, you may want to pose these questions at the beginning and end and look to see if there's a continuation along the scale of I experience these things never to rarely to sometimes to most of the time to no time all the time and things like that. So you want to see kind of a positive change going up those scales. At our annual program surveys for Community Food Centres Canada, we actually directly ask our participants if they've noticed any changes in their mental health since they've been coming to the community food centre, or frame it over the past year. And what we've heard from a lot of our participants is about 80% of our program participants are mentioning that they've seen some change in their mental health. And again, this can be decreased loneliness or a sense of inclusion. Many participants that participate in our programs mention that they're making new friends or feeling that they're part of a community, which are also an indicator of their general well-being. We collect a lot of qualitative data from our participants as well, and some examples of what we've heard from participants in our programs when we've asked them to maybe go a little bit deeper and to tell us how they know their mental health has changed. These are just some quotes that we heard from participants this week or this past year. One participant said, "I have less physical stress, healthier food, and more control over my mental health." Another participant at the Table Community Food Centre in Perth said, "Since coming to the table for the past 2 years, a lifetime of depression is eased. I no longer deal with depression on a daily basis." A participant at the stop told us, "I'm not losing my temper as easily anymore." And another participant in one of our Well Baby programs mentioned, "I didn't eat well or drink enough water, and that made me depressed. Now I've been eating well and drinking water, and now I can function." So the biggest challenge when I think we're talking about mental health and food behaviors is how to link the two together in your program. So you have to make sure that you're able to measure some change in healthy eating habits and healthy diets and healthy eating, and that may be around fruit and vegetable consumption or having people self-indicate to them what it means for them to be eating healthier, and also letting them self-indicate what improved mental health or improved well-being means to them as well.